Hi, I'm Bob Lederer, and welcome to Pharma Research VIDEO Report, where pharmaceutical, healthcare, biotech, and medical device market researchers come for news, insights, and commentary about their field that they just won't find anywhere else. So let's get started. Blackberry's publicized marketing and financial woes may have found a semi-solution in the healthcare field. In April, Blackberry disclosed it had made an investment in Nant Health. That's a privately held healthcare IT firm. And it was also revealed that the two companies were launching a healthcare platform for hospitals. Through it, doctors are able to immediately access and share patient health information with other medical professionals through tied-in medical devices. Plus, they'll be able to consult diagnostic and treatment resources. It's already in 250 hospitals, and connections have been made to 16,000 different medical devices. Now, on top of that, the Economic Times in India is saying that Blackberry is planning a healthcare service platform, which is also being tested at Indian hospitals. Moving on, every American consumer knows all too well about personal information abuse by data brokers. Well, patients in the Carolinas may be about to get a very special dose. Bloomberg Business reports that North and South Carolina's largest medical center group, Carolinas Healthcare, is acquiring credit card, loyalty card, and other public source data about 2 million patients to learn more about their lifestyles. In Carolina Healthcare's defense, its medical officials say all they're looking to do is to identify patients risking illness, especially if they haven't yet been stricken. The purchased information includes increased credit card payments at liquor stores, loading up on junk food at supermarkets, and prescription refill histories. Michael Doolan, the Carolinas Healthcare Chief Clinical Officer, explained the idea is to use big data and predictive models to think about population health and then to drill down to the individual level. Next, the beta tester Glass Explorers Group says it's already seeing the possibilities for Google Glass for surgeons in the operating room. And they think that surgeons will change the way they operate. For instance, pulling up X-rays or MRI images without having to step away from the operating table, just issuing an instruction to the Google Glass, or issuing a voice command to record video when an unexpected problem occurs. And last week we spoke at length with Best Practices LLC Chairman Chris Bogan about pharmaceutical companies' sudden interest in payer research. Now, that's only one of several pharmaceutical and healthcare research bust-outs, all potential pharmaceutical research department opportunities. So I asked Chris if all of this growing research demand means that market research departments inside pharmaceutical companies have so much more on their plate that they can't help but become vital to the senior level bosses they report to.
I worry a lot about the future of market research because I worry that for some organizations, good people are riding on basically a commodity role. And I think with our most sophisticated customers, they're asking this question: how do we prevent market research from becoming a commodity internally? And how do we ensure that market researchers are viewed as business advisors within the company? And those are complicated questions. When you have a customer that's a client that is great and really gets it, it's a pleasure. They bring insight, they guide you, they shape it, they shape the matter, and the vendors do deeper, better, faster, more insightful research. When the absence of that, when you get fuzzy questions, fuzzy guidance, just bring it back to me, typically people are less excited. And so if people are rushed, they don't understand, all these changes, and all they're doing is managing and moving data. They become go-fetch participants in a process to go get data. Then what happens is there's less insight. There's typically more backwards-looking, rearview mirror, reflections of the market, and you have much higher likelihood of missing insights or failing altogether. And when that happens, the departments get shrunk. You outsource more. You stop doing it, or you move to different areas. So I do worry that the market research organization needs to be changing on many fronts to pick up new powerful influencers and constituents like payers, like accountable care organizations, like integrated delivery networks, as well as healthcare providers and patients. Patients also are another force that in chronic care areas are having much greater influence and impact on the market.
We thank Chris again for his time and his insights. And by the way, Best Practices LLC studies are in many cases a must-read. So check out best-in-class.com for a list of available reports. And you can contact Chris directly at cbogan@best-in-class.com if you'd like to interact. That's this week's Pharma Research Video Report. Hey, did you know that we're available in the cloud for those of you who can't view YouTube either in your place of work or elsewhere, or that you can download the RBDR app from the Apple Store and thereby watch PRVR on your iPhone, iPad, or iPod Touch? Just asking. And these are obviously more ways to share Pharma Research Video Report with your friends and peers in the business, which we hope you will do. Have a great research week, and we'll see you back here soon.